The new medical practice, Known Well, recently opened in Needham with a goal of changing the structure of healthcare to fit all bodies. Its goal is to provide primary care and obesity medicine that's free of bias, blame, and shame. The office on Great Plain Avenue is now open for virtual and in-person visits. Catherine Brody spoke with the CEO to better understand the importance of their mission.
Known Well is described as a comprehensive and empathetic approach to healthcare. Can you give us a little more insight into what that means for you?
Sure, and this really came about because of my experience as a patient. And I think a lot of patients have experienced this. If they've struggled with their weight, to find healthcare providers who take them seriously, don't blame everything on their weight, but can also provide help if they want to change their size. And we thought, rather than having to find care in all different places, let's create one comprehensive place where people are seen as a person and their goals are supported.
I believe online it was quoted that you felt like it was your life's purpose. So that's a pretty big deal.
It is, and I'm fortunate to get to work in the area that I think is so important to me. You know, I've moved a lot and I've had to reestablish primary care a lot and also look for treatment for my obesity at times that I was treating it. And it was really difficult for me to find providers who I felt like would take me seriously. It's just so common, I think people have experienced, for a physician to say, did you know you're overweight? You should eat less and exercise more. The research is really clear that just giving that advice is not helpful. And I felt like it should be easier to find doctors who understand the condition and who can treat patients, again, whether it's for their obesity or not, but also just as a wonderful primary care doctor. And when I couldn't find it, you know, this is an issue I've struggled with my whole life. I thought I should find some people and try to create it.
It's surprising knowing that about 70% of Americans struggle with being overweight or are affected by obesity. So why do you think the healthcare system has so poorly addressed those patients?
I think there are two big causes. The first is that medical school really provides no training in obesity, right? It's or, you know, folks being overweight. It's typically 4 hours or less of a medical school training. There aren't any other conditions that get that little airtime, right? Especially something this common. It's not that they don't care, they don't have the training. And the second is, in most physicians' offices, particularly in primary care, they don't have, you know, many of the services needed for folks who do want to focus on their obesity, like dietitians, remote patient monitoring, other things that patients need. And of course, you know, societal expectations don't help.
When a patient comes to your office, what are some of the takeaways that you hope they leave with? And how do you hope they feel if they do come in for an appointment, as opposed to other hospitals?
Yeah. I hope that they feel that they were seen and known, kind of why we're called Known Well. And I hope they feel that they were supported in their individual goals. So if a patient wants to see us for primary care only, we're happy to see them for primary care and just be the doctor that they've been looking for. If they also want to focus on their metabolic health, we'd love to see them for metabolic health. Or if they want to do both, right? We can kind of do one or the other. And I hope that regardless of which journey they take with us, they feel that they were really heard and appreciated.
Well, thank you, and thank you so much for being here today.
Thanks so much for having me.